If you have wrinkles or horizontal lines on your neck that are starting to bother you, today we are going to be going over what causes them and how to fix it. I'm Dr. Sam Ellis, and I'm a board-certified medical and cosmetic dermatologist in Northern California, and I'm here to help you understand your skin and find products that work for you. So if that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. During my cosmetic consultations, one thing that a lot of people will bring up are these horizontal lines that go across the neck. Some people call them necklace lines or tech neck lines, but what I can tell you across the board is people want ways to get rid of them or make them less noticeable. And I should say before we get into this that there's nothing wrong with having horizontal lines on the neck. They are not necessarily a sign of aging either. I see 8-year-olds and 12-year-olds out there who deal with these, so there definitely is a strong genetic component, and we'll be talking about the other causes later in this video. But I just want people to know that if you have lines on your neck, it's not necessarily a sign of you getting older, and you certainly don't have to treat them if they don't bother you. In general, the neck is sort of subject to different aging changes than you might see on your face. And it's one of those things where people don't really notice their neck until they notice it, and then they can't notice anything else. When you compare the skin on the neck to the skin on the face, neck skin tends to be thinner, it's more delicate, and it's just more prone to showing the signs of wear and tear. The other thing is, as your neck ages, it doesn't tend to rebound as quickly, and it doesn't tend to be as responsive to cosmetic interventions, which we will talk about later. As the skin ages, whether that's through external forces like UV radiation or sunlight versus the natural intrinsic aging that our skin goes through, we often will see the breakdown of collagen and elastin, the structural support proteins in our skin. And as that breaks down in our neck skin, that can manifest as more crepiness, more wrinkles, and making us more prone to seeing those horizontal bands or lines in our neck. But aside from the normal aging processes that we think about with skin everywhere on our body, the other thing that neck skin goes through is this constant bending and extending. And that repeated motion of putting the chin down towards the chest will accentuate these lines over time. Now, a lot of people these days will refer to these horizontal lines as tech neck because as we look down at our technological devices like our phones or our computers, those lines can become accentuated. But people have been getting these lines for centuries because literally anytime you look down, whether that's because you're reading, looking at something below eye level, or tucking your chin when you're sleeping, which is a huge cause of these lines, they're going to develop over time. Now, some people will be more prone to developing these horizontal necklines just based on genetic factors. So for example, people who have a longer neck, when they bend their chin down to their chest, it's actually harder for that skin to fold over on itself, and they're less likely to have those lines. Compare that to someone who has a slightly shorter neck, and as they bend their chin towards their chest, that skin is going to fold over or crease more readily. Also, the skin can vary in thickness on the neck. Some people have quite thin skin, other people's will have thicker skin or more neck fat. And when you have more fat in the neck, as you bend your chin towards your chest, there's more opportunity for that skin to fold over on itself or be redundant and therefore more likely to crease. So to summarize, the main causes of your horizontal necklines are your skin genetics and neck anatomy, as well as the natural aging process, sun damage, and other external factors that affect skin aging, and finally, repeated folding of the neck skin. So now that we understand the very basic causes of these horizontal necklines, let's get into treatment and ways to make these necklines less apparent. And I always like starting off with things that you can do at home. And first off, probably the most important, but also maybe the most difficult suggestion that I'm going to give you is to work on your head and neck position. And what I mean by that is so many of us are in the habit of looking down at our phones, at our other devices, while we read, while we sleep, and all of that repeated folding of the neck skin over time is going to cause those horizontal necklines to be etched in. And I think part of this just starts with being more aware and more cognizant of how you're holding your devices in general. So many of us, and maybe you're watching right now, are looking down at a computer or down at a device. So is there a way for you to raise up your phone or raise up your tablet or computer so that it's more at eye level and you're not constantly tilting your chin down towards your chest? I know when I read before bed, I like lean back and tuck my chin. And so I'll ask my husband, I'll be like, is my neck creasing right now? And he'll be like, yes, it is. And not that I want you to be thinking about your neck creases or your neck folds all the time, but it's those little things that add up. And so when he says, yeah, it's creasing, then I'll just kind of like adjust things and shift. And now I don't have to worry about it. I think one of the best things you can do is learn to sleep on your back. And I'm telling you this as someone who is unable to sleep on my back. I've tried so many things. So if you have any tips for learning to sleep on your back, definitely put them in the comments. I know there's lots of pillows that help with that, but just think about it. If your chin is curled up and tucked into your chest because you're a side sleeper, that is like 6 to 9 hours every single night that you are reinforcing those horizontal bands. So even if you're on your back for just part of the night and you're spending many fewer hours per night creasing your neck, that's going to benefit your neck in the long run. That being said, I always want people to be comfortable while they sleep because there is no greater health benefit than getting good quality sleep. So if sleeping on your back doesn't make you get a good night's rest, it's totally not worth it. Aside from becoming more aware of your neck position and what you're doing on a day-to-day basis, of course, we want to be taking really good care of the skin on our necks with what we're putting on it. And how many times have you heard a dermatologist or an esthetician tell you, bring your skincare down onto your neck and chest? And that is so key because anything that's causing premature aging of your face, of course, can affect your neck as well. The number one thing you need to be putting on your neck every single day is sunscreen. And don't just think about the front of your neck. These horizontal bands extend all the way onto the sides. And so many times I see people putting sunscreen on in videos and they don't bring the cream all the way around to the sides of your neck. But the sun is coming at you from like a 360 view here. And if you don't wear your hair down, you should bring it onto the back of your neck as well. But having sun protection on your neck is important. Aside from sunscreen, if I could give you one other product category to use on your neck regularly, it would be a topical retinoid. So that can be something that you get over the counter like retinol or retinaldehyde cream, or it can even be prescription tretinoin. Now, one issue that will come up when people are applying retinoids on their neck is they will have increased sensitivity. One of the reasons for that is the neck has fewer sebaceous glands, so fewer oil glands, so things cause irritation much more readily on neck skin. For example, I use prescription tretinoin on my face on most nights of the week, but I can only tolerate it on my neck 1 to 2 nights a week. And because of that, I've actually switched to using either a retinol or retinaldehyde product on my neck so that I can tolerate it more nights per week. If you followed me for a while, you know I'm a huge fan of the Medicate Crystal Retinal 20. So that's like the strongest retinaldehyde product that you can get over the counter, or at least that I've found. And it's right at the border of where like my neck can tolerate it, but I still want to use tretinoin on my face most nights. So if you're interested in something that's like a step down from tretinoin, but still has really good anti-aging effects, that might be worth pursuing. But I should also note, if you're just using a traditional retinol product, that is still great. Use that regularly on your face and neck, your chest, your hands, anywhere that you have aging concerns, and you're going to see benefits over time. In terms of other things that I like to do at home for my neck and for my face, I'm a big fan of red light therapy. I have a whole video explaining the benefits of red light therapy, so you should definitely check that out. But in general, red light can help penetrate the skin a little bit deeper and stimulate collagen. So anything that I can be doing to make the skin in my neck stronger and more supple is going to help with things like horizontal lines. I personally use the red light masks from Omnilux. I have one for my face, and then they also make one that specifically fits around the neck and onto the chest, and I just kind of wear them at the same time. And then one other thing you can do at home is wear some type of silicone patch to prevent the creasing of your neck. So say you are a side sleeper and you notice that when you tuck your chin to your chest, you're seeing that redundancy or that folding happening in your neck. You can actually take a silicone patch and apply it over the crease so that when you tuck your chin towards your chest, you're not folding or creasing the skin. Now, I will say this takes some upkeep and some diligence, right? So you have to kind of think to yourself, well, am I actually going to do that every night? And is that worth it? Also, you have to be careful about putting those patches over active ingredients like retinoids because it can make them more potent and potentially could cause more irritation. But I had a patient who she noticed that when she was working from home, she was just like looking down a lot and it didn't really make sense for her to raise her computer just ergonomically, but she started wearing them at home while she was working, and doing that during the day seemed to be very helpful for her. And I can imagine you might be thinking, well, is there a value to using a targeted neck cream? And I have some thoughts on this. If you are going to invest in a specific neck targeted product, there are certain ingredients you may want to look for, and we think of them as kind of traditional anti-aging ingredients like peptides, growth factors, retinoids, of course, sun protection. But also, I think it's great if you're going to invest in a neck product to make sure that that company has done some type of clinical testing on neck skin. For example, a couple of famous or well-known neck creams in the industry are one called Nectifirm from Revision Skincare. They have a clinical trial showing how it improved neck skin over 12 weeks. Another example is by Neostrata. They also have a firming neck cream that is beloved by people. So again, if you're going to invest in a neck product, just make sure it is vetted and is going to do what you expect it to. I also want to give a quick shout out to topical estrogen estrogen therapy. So for women who are perimenopausal and have truly estrogen deficient skin, prescription strength estrogen compounds can be applied directly to the problematic skin and have promise in showing improvements there. So those are some things you can do at home. And the most important thing with at-home treatments or interventions is consistency over time. These types of things do not yield results overnight, but having years of good skincare habits will undoubtedly lead to improvements in your skin and prevent the worsening of skin conditions that bother you in the moment. And that's part of skincare, is not just thinking, okay, I'm going to reverse every issue that's on my skin that I notice, but also can I prevent it from getting worse? Because sometimes even just putting something in a holding pattern can be beneficial. But now let's talk about treatments you can get in the office, because sometimes that will lead to a more noticeable and quicker improvement. Let's start off with talking about Botox, because I get a lot of questions about using Botox in the neck, and it can be beneficial for neck skin, but I don't find that it leads to a lot of improvements in the horizontal necklace line specifically. So Botox in the neck is great for the vertical bands that can happen from the platysma muscle being hyperactive, and it can be good used as micro Botox placed superficially all over the neck to help with crepey skin. But when you think about the origin of a horizontal neck crease, there's a lack of volume there, plus that repeated folding that's causing an issue. So augmenting something with a neuromodulator or affecting the muscle tissue of the skin isn't really going to be beneficial. I think one of the most beneficial things that you can do for these horizontal necklines, if they bother you, is doing a very small amount of hyaluronic acid filler directly into the lines. So hyaluronic acid fillers are things like Juvederm, Restylane, Belotero. These are dissolvable products, so if you didn't like it, you can get rid of it, that can be placed very superficially to help pop out or plump that line. Now, if you have something like this done, it's not a guarantee that it's going to work. Some people's skin responds beautifully to this type of intervention, and some people, you do it and you hardly notice they had anything done at all. But I think if these lines really bother you, that's a great place to start. Depending on your unique neck anatomy, this would probably be done about once a year, just to keep these areas plumped and smoothed. Now, I will say with any of these interventions, including getting filler directly into the necklines, we are hoping for improvements, not complete smoothing of the line overall. Typically, by the time someone is seeking treatment, that crease has been getting etched in for quite a long time. So we are just trying to support that skin, but we're never going to be able to completely eliminate that crease. Aside from traditional hyaluronic acid-based fillers, which are like gels placed into the skin, you could also consider doing a biostimulatory filler like Sculptra or Radiesse into the neck. Now, to contrast, when I'm injecting a hyaluronic acid-based filler like Restylane or Juvederm into the necklines, we're going directly into the lines and kind of threading it across. Whereas if we're using something like a biostimulatory filler, we do something called a neck wash, where we are putting a very thin layer of that product throughout the entirety of the neck to improve collagen and elastin. When I'm performing a biostimulatory neck wash, I'm not really targeting those specific horizontal bands. We are really targeting the overall quality of the skin on the neck, and in turn, those bands can improve. I would consider this a very advanced procedure to perform. There are a lot of very important structures that reside in the neck that affect your safety. So if you are going to have this done, make sure it's done by someone who knows what they're doing. Aside from performing injectable treatments on the neck, you can also perform resurfacing treatments to improve the quality of the neck skin overall. So for example, in my practice, something that I do for a lot of necks is microneedling. Now, I have an entire video dedicated to talking about microneedling, so be sure to check that out. With microneedling, the goal is to cause controlled micro trauma to the skin so that when your skin is healing from that trauma, it can build itself back stronger. I do a lot of microneedling in my practice specifically for the neck. I use a ton of lasers on the face, but you have to be very careful with lasering the neck because it doesn't have as many oil glands or hair follicles. It doesn't regenerate itself as readily. So I could use really high settings on someone's face to resurface their face, and you have to turn it way, way down when you're treating someone's neck. Otherwise, you risk things like scarring or permanent injury. And microneedling sort of comes in two flavors. You have traditional microneedling, which is using just the direct physical trauma of those microneedles to stimulate the skin. And then there's radio frequency microneedling, where those needles are heated. So you're getting this additional heat trauma to the skin. If you are going to do something like radio frequency microneedling on the neck, it needs to be done so carefully because that additional trauma of the heat, again, can cause more issues for the neck if not done properly. And when we're talking about resurfacing, I don't want you to think that you can't use lasers on the neck successfully. I laser necks day in and day out in my practice, but it just has to be done very carefully. And the amount of improvement that you'll see in a single session when treating face skin versus neck skin is going to be very different. So in my practice, I use Fraxel and Clear and Brilliant to resurface the neck. And typically we do it if someone is also treating their face. I think one of the best things you can do if you're already getting laser treatments on your face is bring them down to your neck. Of course, the settings need to be different, but don't just address your face skin. That's a huge mistake that I just see people make time and time again. And I cannot tell you how many times I've had patients do an entire treatment on their face, a series, whatever, and then they finish and they go, I really should have included my neck. And I just want to say, yes, I agree, and I told you that from the beginning. So aside from injectables and laser resurfacing, other things you can consider in your neck are something like Kybella, so a fat dissolving injectable. If someone has a lot of excess fat in their neck that's causing the skin to fold on itself, something that reduces that fat can be helpful. I don't personally use a ton of Kybella in my practice for the neck skin specifically, but if someone has a very strong preference to not undergo any surgical options for their neck, which I'll talk about in a second, then Kybella is an option for reducing that fatty layer on the neck. And that really transitions me well into the final set of interventions you can do for these horizontal necklines, which are surgical interventions. Namely, that's going to be a surgical neck lift, which is typically part of a facelift, as well as liposuction if someone has excess fatty tissue on the neck that also needs to be addressed. If you're struggling with horizontal necklines, but you also have some sagging, hanging, or just additional laxity around the chin and the neckline, then I really find that a surgical intervention is by far and away the most effective thing you can do to improve all of that. So that really sums it up on treating necklines. I'm curious, have you done any interventions, whether at home or in the office, that you have found beneficial? Definitely let me know in the comments. As always, thank you so much for being here. Don't forget to like this video and subscribe to the channel, and I'll see you next time.